the technicality of it, how well it is set up, the science behind it. It is very well structured, and the fact that we've seen a live surgery and we've seen results very much immediate, and we're going to see the patient tomorrow. This is something very interesting.
We see a trend in increasing number of patients having recession, and I think this is a conservative approach, and it'll help my practice and my patients, and I think it's a good service.
I have a question to Dr. Chao. I saw the surgery yesterday. I'm very impressed with the pictures I see now.